Now, the Krasner and Rankow's laws of opening. When we have to do the root canal treatment, we will first do access opening. That is, we want to access to the root canal, and we will gain access from the enamel portion, and then we'll lead towards dentine, and then we'll reach towards the pulp chamber. This is the pulp chamber, and this is the proper root canal of the tooth. So when we have to reach the root canal of the tooth, for the purpose of root canal treatment, we will first gain access towards the pulp chamber, that is the coronal portion of the pulp. And root canal is basically the radicular portion of the pulp. So, we will be teaching about law of centrality, that is, the floor of the pulp chamber is always located at the center of the tooth at the level of CEJ. So, this is the CEJ, that is the junction of the cementum and enamel. So, this is the portion where cementum and enamel is meeting, and this is cemento-enamel junction. So, the floor of the pulp chamber, this is the floor of the pulp chamber, and this is the roof of the pulp chamber. So, the floor of the pulp chamber is always located at the center of the tooth. So, this is the central portion of the tooth, and the pulp chamber is located in the center of the tooth. Pulp chamber. This is the occlusal portion of the anterior tooth. Now, the law of concentricity. First, we'll read about concentric circle. What is called as concentric circle? The circle having the same center. We can draw numerous center from the same, we can draw numerous circle from the same center. This is the center, and these are the circles, concentric circles. So, if we consider tooth as a circle, we can consider tooth as the center, as a circle, we can consider tooth as a circle, and this is the central portion of the tooth. Pulp lies in the center of the tooth. So, the walls of the pulp chamber, so there could be the 4 walls of the pulp chamber. Let it consider as this is the buccal wall, this is the lingual wall, this could be the mesial, and this could be the distal wall of the pulp chamber. So, the walls of the pulp chamber are always concentric to the external surface of the tooth could be like enamel, dentine. So, the walls of the pulp chamber are always concentric to the external surface. So, we can consider the outer surface as enamel, then the dentine, and then pulp. So, this would form a concentric circle, and pulp lies in the center of the concentric circle. And when we talk about the cemento-enamel junction, are always concentric to the external surface of the tooth at the level of the CEJ. At the level of the CEJ, this is the CEJ, this is the CEJ portion of the tooth, and the walls of the pulp chamber are forming a concentric circle to the external surface of the tooth at the level of the CEJ. Now, the law of cemento-enamel junction, the distance from the external surface of the clinical crown. Clinical crown is the portion of the crown that is visible clinically. Clinically visible portion of the crown. Clinically visible portion of the crown that we can see in our oral cavity. The distance from the external surface could be like enamel or dentine, or it could be like cementum when we talk about the radicular portion of the tooth, to the wall of the distance from the external surface of the clinical crown to the wall of the pulp chamber. When we approach from buccal side, we can approach from lingual, we can approach from mesial, and we can approach from distal walls. These are all the walls of the tooth, and there could be the wall of the pulp chamber also, is always same throughout the circumference of the tooth. So this is the circumference of the tooth. This is the circumference of the tooth. We are talking about here in 2D, two-dimensional figure. We are seeing over here two-dimensional image of the tooth. Is always same throughout the circumference at the level of the CEJ. So this is the CEJ or cemento-enamel junction, and there could be like mesial, distal, buccal or lingual wall, and the distance from the external surface of the clinical crown to the wall of the pulp chamber is always same throughout the circumference of the tooth at the level of the CEJ. So CEJ is the most consistent, repeatable landmark for locating the position of the pulp chamber. When we have to locate the pulp chamber, we would think about the CEJ only. So in every law, that is the law of centrality, law of concentricity, and law of CEJ itself, CEJ is playing a major role.